Hello, my name is Aarya Ramprasad, and I will be presenting on behalf of my team's poster named Imaging versus Physical Exam: Reconciliation of Patients with Disc Degeneration. So degenerative disc disease is a commonly occurring syndrome where there is deterioration of the intervertebral disc in the spine, with 40% of people aged 40 having this disease, increasing to 80% at the age of 80 or older. It occurs when the cushioning present in the spine starts to wear away, leading to pain and decreased mobility. Processes that end up expediting this include drying out of the disc, daily activities, sports, as well as injuries. Medical history and physical exam are what we use to diagnose, with some physicians using imaging to strengthen their case. Many patients end up being falsely diagnosed with disc degeneration due to its similarity to other musculoskeletal issues, including temporary muscle strain, sacroiliac joint syndrome, compression fractures, spondylosis, and neoplastic disease, and others. Many other diagnoses can only be differentiated using imaging, which can change a patient's treatment course. Our study aimed to determine the population of patients with a diagnosis of disc degeneration supported by a physical exam and imaging. Our methodology included 600 surveys being sent out to patients across the country who had a medical history or a current differential diagnosis of disc degeneration. The survey included a description of the study as well as confirming the patient's interest in participating. The survey included questions on how the patient was diagnosed, including options of solely a physical exam versus a physical exam as well as imaging, such as X-ray, MRI, or CT scan. An optional question on how patients felt about their diagnosis and how their symptoms have progressed after their diagnosis was also included. For our results, out of the 600 surveys we sent out, we received 156 surveys in return. Each reply confirmed that they had received a diagnosis of disc degeneration via either physical exam or physical exam and imaging confirmed by a radiologist or an orthopedist within the last 5 years. Out of the 156 respondents, 112 patients stated that they were diagnosed solely with a physical exam, while the remaining 44 patients stated that they received a diagnosis with a physical exam and imaging together. We had a 26% response rate for our study. And so our results showed a higher frequency of patients receiving a degenerative disc disease diagnosis solely via physical exam. 28.2% of our respondents received imaging in conjunction with the physical exam for their diagnosis. People can argue and say that imaging can help show a quote objective truth. For disc degeneration, you will see narrowing of disc spaces, prominent vertebral body osteophytes, reduced fluid signal within the disc, and darker appearing discs on MRI. For some of our optional responses, many patients who stated that they had solely gotten a physical exam for their diagnosis stated that they may have not been given the proper diagnosis or that their treatment that was recommended had not been helping them significantly. Follow-up studies could use a similar model, but add an additional component to complete imaging in patients who had not had imaging prior, but did receive the diagnosis to see the percentage of patients who had, quote, a true diagnosis supported with the imaging findings. Physical exam is universally known, but it can be difficult to standardize due to its different terms of interpretation because of the variability of human nature. This can end up leading to varying numbers of diagnoses that may be similar but incorrect in the patient's case, such as similarly presenting differentials such as osteoarthritis or spinal stenosis. Another weakness in our study is that these surveys rely on the patient's word. Patients may have incorrectly remembered getting imaging for their diagnosis, or may have not been truthful in the survey, which could skew results, especially with a 5-year time period which was allowed in this survey. Working towards continued encouragement of using the physical exam alongside imaging when necessary to help confirm diagnoses can help provide more accurate numbers towards the population that truly does have degenerative disc disease. Thank you so much for your time, and I would love to take any questions that you have now.